Thank you so much. And it's an absolute delight to be here talking to people who are working on the ground to really improve outcomes for children and young people with asthma. What I'm here to do is to tell you a little bit about what Asthma and Lung UK are doing in this space, and a little bit about our priorities going forward as well. So next slide, please. I'm sure many of you know what a terrible state respiratory disease is in the UK. The stats are absolutely astonishing. And we're actually the worst in Europe in terms of outcomes, and this is for a whole number of reasons, but I think essentially it isn't recognised as a priority by system, by government, by people in general, and that's something that we really do need to change. But specifically, we need to sort of work together, I think, to achieve that change, both at a system level and in terms of everyday care. And of course, healthcare is a really important part of that picture, but it's not the only part. There are other drivers of poor outcomes, environmental drivers such as clean air, and that's one of our focuses going forward as well. So next slide, please. I'm sure you, again, will know many of these stats, but it is astonishing that 1 in 11 children are affected by asthma, one of the most common long-term respiratory conditions. What that means actually in terms of London is 3 children in every classroom are affected by asthma. It's absolutely enormous. And yet, despite the prevalence levels, and maybe because of the prevalence levels, and therefore it's just kind of accepted and normalised, children are experiencing worse care than adults in terms of their sort of the good basics of care. So, for example, less than 1 in 4 children have a personalised asthma action plan, a really important part of basic care in terms of controlling asthma. And we know that that's even worse for children, young people who are living in deprived areas. And that's something that is a theme throughout this talk, really. Next slide, please. The Sabina Junior study that many of you will be familiar with, interestingly found in 2023 that the prevalence and the incidence is actually going down in terms of asthma. Maybe by, I think the figures here are probably a little bit exaggerated. It's more like half is going down over between 2008 and 2018. And yet exacerbations are going up, which is sort of telling you that there's something going very wrong in terms of good basic care, I think. And we know that the study also showed that it's, again, even worse for children who come from more deprived backgrounds. So there's a big job to be done in terms of improving care and outcomes. Next slide, please. The clean air aspect of this is really important as well. As I said, healthcare and the way that we deliver it and the way that we help support people living with a condition and parents and carers is critical, but they can't do much about the air that they breathe, actually. And the impact of air pollution is really enormous. It affects all of us, but it particularly affects young people, and we know that lungs are being stunted by toxic air, and it's worse, of course, in areas of high pollution are often the more deprived areas. So we really need to deal with this bigger environmental determinant of ill health, as well as the day-to-day healthcare aspects. Next slide, please. So what are the other drivers of poor outcomes? Well, as I mentioned right at the very beginning, there is definitely a lack of attention, a lack of urgency, a lack of prioritisation when it comes to respiratory care overall. And we think that, you know, the urgency with which cancer, with which cardiac is treated, is something that should be applied to respiratory. There's a big gap to be made up here. And too often asthma's severity is underestimated. I think people, you know, tend to think oh, it's just a childhood thing, or it's just a low level thing, doesn't really matter. You know, sometimes we have bad days and we can get over them and that's it. Well, of course, we know that isn't the case. And we know that asthma is still killing people, still killing children, and it doesn't have to. And the things that need to change around this, we've known about this for a long, long time. So we know what we need to do. It just needs to be put in place. One of the most shocking stats that I was given was about the fact that when children go into hospital, something as simple and obvious as the fact that their inhaler is not full or doesn't have the treatment in it, it's just shocking. 1 in 12, sorry, 1 in 10 children roughly going into hospital because they're having an asthma attack and their inhaler is empty. Now, this has been picked up by the National Child Mortality Database, and they are going to be reporting later this year on this whole issue because of the deaths that have been linked to asthma and people not having their inhalers full. So, you know, we really think that this is something obvious that needs to be changed. We're calling on the MHRA to ensure that all inhalers that are approved going forward, they have an integrated dose counter to help people manage that particular aspect. And it seems such an obvious thing to do. Why don't we get on and do it? Next slide, please. We know that for poorer areas, children living in more deprived backgrounds, the outcomes are worse. It's the same, and it's obvious sometimes a multiplier effect for children who are coming from minority and ethnic backgrounds. Half of all children admitted to hospital compared to 28% white children. You know, why is that happening? We know that if you come from a Black ethnic and minority background, you are 54% less likely to receive follow-up care after hospital admission. And yet, all of the reports, all of the guidance says it's vital that you get that follow-up care, because that's the point that you can intervene and say, let's look at how things are being controlled, let's make sure we're on top of it, your inhaler technique, all of those vital but simple things. So often lack of follow-up after hospital admission has been associated, unfortunately, with death from asthma. Next slide, please. Many of you will be familiar with this one. Going back to school, you know, the spike in asthma attacks, the spike in terms of people going into hospital as a result, most of you will be familiar with that. And again, that deprivation issue is showing very strongly from the research that the charity has done. You're 4 times more likely to be hospitalised from an asthma attack in September from a most deprived area than from a least deprived area. These are obvious kind of signals that we can intervene on. We can say, we know this is going to happen. Why don't we make sure that you know, people are supported and helped in the run up to going back to school, so that we don't see these kinds of spikes, or not to the same degree. Next slide, please. And here's a lovely example of a family who have dealt with a child being diagnosed with asthma. So Kate and Sorcha, if we go to the next slide, Kate contacted us about her experience with her lovely daughter, who's 8. And when she was initially diagnosed, she had really uncontrolled asthma, and it was massively affecting their lives. Next slide. Particularly affected by cold, and during the winter it was really hard to control her asthma. But they did manage to get on top of it, and with the support of a really good healthcare team, looking after the basics, making sure that they knew what the triggers were, they managed to get on top of it. And next slide, please. The outcomes are fantastic. Here she is. She took up figure skating and is actually really good at it and winning competitions and having the best life. So it shows that if you deal with the basics, if you have that supportive environment, then the outcomes for children are fantastic. We've just got to make sure that that is consistently applied across our systems. Next slide, please. So what does the charity do? I'm sure many of you will know that we produce an enormous amount of support and guidance on our website. Just heard earlier, just at the end of the last session, about asthma action plans. And yes, we do indeed have a marked asthma action plan. I can't even say it, but there's loads and loads of these little sort of templates and tools that people can use to help control their asthma and to support parents and carers. And we also have recently set up a parent and carer support group. I don't know how many of you know about that. You can go onto our website to find out more about that. And indeed, I think it's next week, the 25th of September is the next online meeting of that group. Our parents have found it incredibly useful to be able to go and share their experiences through that group, and also hear really interesting information and education for experts. So next slide, please. But it's not just that direct support that we give. We also support research and innovation, which is going to be critical to getting those longer term solutions in place. We have a huge portfolio of work in this area, and including direct support for medical research, and interestingly get involved in things. You can see here the London ULEZ scheme. We're involved in that evaluation, so beyond the traditional experience of medical research. So next slide, please. For example, here you can see some of the direct research projects that we're funding, but this is just a sample. Again, on our website, we have so much more that you can see, and please do contact us if you want to know more about that. But I think one of the most important and potentially most impactful things that we're doing is trying to drive up overall funding on research and innovation. There's only so much the charity can do. We've got fairly limited resources. Research costs a lot of money. In the UK, we know that research from public sector funding is massively underfunded. Something like 2.5% of the overall funds available are being spent on respiratory generally. It should be much, much higher, at least 3 times higher. So we are doing a lot of work talking to people like NIHR, to the research councils, LifeArc, etc., about the need to start to prioritise respiratory, because it's been so underinvested, and that is starting to have some impact. And I'm hoping in the next year or so you'll see some things coming down the track that will make a difference there. So next slide, please. The gone backwards. Just going to go forwards again, couple of slides. The other thing that we do as a charity, which is probably one of the most important things that charities do generally, is advocating on behalf of people with asthma. And we have a new government. It's a great opportunity to actually try and make a real difference, because the government's kind of priorities and thinking, you might have heard today, you might have seen the papers this morning, Lord Darcy's report is out, and the government is saying, we need significant change. But the areas that are being focused on and highlighted are areas that actually chime in with respiratory. So prevention, the real emphasis on environmental prevention. So things like the tobacco and vapes bill, which I understand is going to be published in the next 2 to 3 weeks. We're massive supporters of this. It will make an enormous difference to our children and young people growing up, but also a clean air bill, which needs to come down the track. So prevention, really, really important focus of this government. But equally, paying attention to people who've got long-term conditions and keeping them out of hospital. So investing in primary care and community, and that's where most people, and certainly children with asthma, are being supported, is in those areas. So we need better support there. So hopefully we have an opportunity, a fairly constrained and tight opportunity, to really influence the upcoming 10-year plan to say, put respiratory care and make it a priority, and put those changes that we know need to happen, get them into place. Next slide, please. We're also, involved in things like new guidance. You know about finally, I understand there were lots and lots of guidance around asthma. We've finally got an integrated new guideline for asthma, which is being consulted on at the moment. The charity had submitted its own response to that consultation, just making sure that Pheno is actually properly available, both in terms of access to the test and making sure it's in the right place in terms of the diagnostic journey. So we've been advocating for that, advocating for more child-focused monitoring tools, such as the child asthma control test, making sure that that's actually embedded into the guidance, and the need to really empower clinicians going forward to make sure that they can apply these guidelines accurately. Next slide, please. And then the other big area, finally, that we're working on, as I said at the beginning, is around clean air. Really important to get this right. It's phenomenal what I found it very difficult to I didn't know much about respiratory until I came into this role, and then you start to read up and you realize what an enormous challenge actually having toxic air is, and I don't think the public know enough about it, and it's our sort of role really to drive home what a difference this makes, not just for people with lung health, poor lung health at the moment, but for all of us. So we have a lot of work in terms of getting local campaigning networks together, really driving home the message that we need to do something about it. We need a clean air bill. We have to have a new Clean Air Act, which is the last time we had a really important one was, what, 70 years ago? And we need to clean up our act now. Next slide, please. Just today, we have been undertaking some campaigning activities. We've been out and about in parks in Birmingham, London, and in Manchester, just highlighting the impact of toxic air. Of all of the playgrounds in the UK, 99% of them have air which exceeds the World Health Organization's limits on air pollution. 99%. That means you can't escape it if you are in a children's play area. That is appalling. We need to stop that, and we need to change it. Next slide, please. So the example of somebody who is living with the effects of toxic air. So Jordan here and her 3 children, she moved from Portsmouth, I think it was, to Lewisham, just to be closer to family, to help with the children, perfectly sensible thing to do. She regrets it enormously because the air pollution has taken a massive toll on her family. She has asthma. 2 of her children have asthma. They don't have access to a garden. They go to the park to play and get exercise. They do everything they can to protect themselves. So they check pollution monitors, they avoid main roads, but they can't stop the toxic air getting to them. And it's making such a difference in terms of their experience of asthma. And they know it's that because when they went down to a holiday recently in Cornwall, for example, their son there, Matthias, simply didn't need his inhaler. So this is the day-to-day reality of living with toxic air. Next slide, please. And then finally, we're working on the ground as well. So we have a programme of work called Clean Air Champions, working in schools, offering resources, air pollution monitors to help the schools understand what the really local impact of an experience of air pollution is in their area. We've had 164 schools get on board, 48 of them in London across the 26 boroughs. And we are really encouraging people to sign up, because this is a great way to get local activity and local understanding of the impact of the air that everybody is breathing in their area and the potential impact of the pollution on health. So we're working at a local level, we're working with the system, we're working long term in research, and we love working with you guys. So thank you so much, and I will leave it there.